Hi, I'm Paul Vinger, and that's my father's last name. My mother was Ida Benedita Rosso, Sicilian lady, and I became a doctor because my godfather, who was a big deal, was Uncle Frank, who was a military doctor, and then he was a general practitioner in Union City, New Jersey, and I liked what he did. And nothing special, no humanitarian stuff, just wanted to be like my godfather.
When I applied to medical school, I wrote my essay on being Sherlock Holmes because I really liked the stories of Sherlock Holmes. I liked the investigation, I liked the clues that he looked for, I liked his innovations. Now, 35 years later, I feel that I am Sherlock Holmes.
I was a little child when the doctor visited us at home. When we were sick, they came home and the doctor seemed like a magical person who had great powers and made us all feel better, and I wanted to be just like that. Then I started to build little hospitals at home and treat my little dolls with all kind of injections stuck in them and so on. So I chose and never, felt anything but fascination and wonder about it since then.
I spent 3 months living in Nicaragua, and I spent time volunteering in some hospitals down there and just loved it. And realized that medicine really combines all different of my loves of working with kids, the science aspect, and just helping others. And that's how I decided medicine.
It's fun to learn, and you're always learning. And it's very rewarding, I must say though. It feels good to be part of people's life and make a difference. So yeah, it is. I will do it again. I will do it again.
We just approach quality and safety from a more systematic way, and I think it's a more effective way to go. So that's one of the things that I'm most interested in, and I'm also most proud of here at Emerson.
I have to say, I like the electronic medical record, and I think if you use it in the best way that you can, it's really a really great tool, and I think it's really improved documentation and management of patients because we just have better access to all their information.
The surgery that I used to do, and I would admit patients for 4 to 5 days afterwards, now I can do through tiny incisions, send them home a few hours after surgery home with a quick recovery. And we do a lot of procedures in the office so the patients don't actually end up in the operating room ever for any big procedure.
Everyone knows Emerson, everyone loves Emerson, and I can see my patients in different places in the community, and I can't even tell you how many times I've been at the Starbucks in Concord, for example, and the person in front of me online is my patient, and the person in back of me online is my patient, and the barista making my coffee is my patient. And some doctors may not like that, it might be too close for comfort for them, but I actually love it.
I love going to the Emerson conferences on Friday morning. Half the time they're about things I had no idea I was interested in, and I'm almost always glad that I went and I learned something new.
The whole leadership is so accessible, so I know that they will listen to me and personalize, even if a lot of changes, but it's not impersonal. I feel that I can trust them, and loyalty, I think, is important. So I will stay for hopefully many more years.
Well, the nurses at Emerson have always been excellent, starting from head nurses on the floor to the administrative nurses and nursing supervisors. So it's been a big plus for this hospital all along, and they're always willing to stay late, work late, and not just for the patient's sake, which is first and foremost, but also because they're helping out the surgeons who at 7 o'clock or 8 o'clock at night can use their good help. So it's always been a plus for this hospital.
The experience at a hospital is made by the nurses. I've been dependent upon them from the day that I entered.
It is really, for me, it is just like you depend on your family and extended family for support. The same feeling I have for Emerson. I am depending on the specialist here.
It just makes sense to be here. It's a lot easier to practice excellent medicine here. And I say that not just as a clinician here, but I live in the community. This is the hospital that my family uses. not only the hospital, but the physicians really treat patients as if the way they would want their own family members treated. And I have no intention of changing that ever.